University of Kentucky in Lexington, Kentucky. Been a public health nurse for many years, and I'm currently the past chair of the American Public Health Association's Public Health Nursing section. It's been a wonderful section for me over the years, and I've grown up in public health through the public health nursing section. I'd like to just talk briefly about one of my most memorable public health nursing experiences that I remember in my practicing days when I lived in Indianapolis, Indiana. It was a home visit that I made in the neighborhood in which I lived, and that I also was an active community member and participated in community meetings within that neighborhood. I went to make a home visit, and I had trouble finding the home because it turned out the home I was looking for had been condemned and wasn't even supposed to be rented to anyone. I went into the home and there were flies everywhere. There was a newborn baby laying on the bed, and the baby was covered with flies. There were no windows, there was no hot water. There were very unsafe fixtures and different things around the house that weren't safe for babies or children. So I set about to try to make a change in that home. I had been at a community meeting about a month earlier and had learned at that meeting that the man who owned the home was not supposed to rent the home. So I started making phone calls to the Housing Bureau and different places, different governmental agencies to try to make a difference. Well, by the end of that day, there was someone at the home putting in screens, working on the plumbing, working on different issues of safety around the home. And I felt like I had really made a difference in the life of that family. But what I think is even more important than making a difference in the life of that particular family at that particular point in time is that we as public health nurses look at it in a much broader perspective, that we're trying to improve the health of populations and not just that family, but we want to be sure that we can assure that there is safe housing, adequate housing, accessible housing, and affordable housing for all of our citizens, not just a few. We need to make sure that we're active in policy level decisions to ensure things like that. And that's the reason that I'm a public health nurse. I'm very passionate about social justice issues and am excited to be part of that process.